We're now live. You can go ahead.
Thank you so much for joining us today. Before we get started, we'd like to begin with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Buenas noches y bienvenidos a la sesión informativa organizada por la supervisora Hopkins y la doctora Mace. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación en español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con supervisora Hopkins.
Thank you so much, Gilbert. I'm Lynda Hopkins, supervisor for Sonoma County's 5th District and chair of the Board of Supervisors. I'd like to welcome you to our St. Patrick's Day COVID-19 and vaccination community briefing on this Wednesday, March 17th. Today, we're going to be focusing on the expanded reopening of schools now that the county is in the state's red tier. Our panel of educators and public health experts will discuss the key concerns that are being addressed as our schools begin to reopen. It's truly impossible to overstate how important opening our schools for in-person instruction is for our children's mental health and education. But it is also vital that for this complex process that we make sure that everyone, students, teachers, and all school staff are safe as we navigate the final stages of this pandemic. We've learned so much about the importance of in-person education over this past year. Schools and teachers, parents, and students have figured out how to make remote learning work during very, very challenging times. But remote learning has also reminded us of the limitations of technology and of the magic that occurs in our classrooms every day when they're filled with students and our dedicated and talented teachers. We are social creatures, and being together in school is crucially developmentally for our children. You know, we're learning as parents. I'm a mom of 3 kids, along with our children as schools reopen. It's a new process for all of us. And I really look forward to learning more from our panel of experts today during our roundtable discussion. In addition to our county health staff, today we are joined by Dr. Steve Harrington, the superintendent of the Sonoma County Office of Education, Dr. Myra Perez, superintendent of the Cotati-Rohnert Park Unified School District, Joe Cimino, board member of the Cotati-Rohnert Park Unified School District, Dr. Gary Green, an infectious disease expert, as well as Will Lyon, the president of the Santa Rosa Teachers Association. But before we go to the roundtable discussion, I'm going to turn it over to my fantastic colleague, Supervisor Susan Gorin.
Thank you, Chair Hopkins. I am delighted to be here this afternoon to talk about and be the cheerleader for opening in the red tier, something that we've wanted to do for months and months. And I'm delighted to actually, as a grandmother and a parent, be participating in the conversation regarding schools opening. There are many advantages to Sonoma County being in the red tier. Our restaurants can now open for indoor dining at 25% capacity. Our gyms can open to 10% capacity, and retail stores can open to 50% capacity. Another plus is that it makes it easier for our schools with K-6 students to reopen for in-person instruction, and also makes it possible for middle and high school students to reopen for grades 7 through 12. Most of our schools with transitional kindergarten to 6th grade students have already submitted reopening plans to the County Department of Health and the state. And plans from 13 districts and a total of 47 schools have been approved as of today. A list of local schools and districts that have submitted COVID-19 safety plans and the status of their plans can be found at socoemergency.com in the Corona Education section. These plans address in detail the safety precautions that a district and individual school sites will take to ensure the safety of students and staff, including detailed testing protocols, how contact tracing will be handled, the logistics of student drop-off, room spacing, air ventilation, and much more. Being in the red tier means that TK6 schools do not need to have their COVID-19 safety plans approved by the county to reopen for in-person instruction. They still need to have their safety plan posted on their website for 5 days before having students back on campus, however. As Dr. Mace, our public health officer, has mentioned before, our county health team still is offering to review the COVID safety plans, and many schools and school districts are taking them up on this offer. Another significant change under the red tier is that middle and high school students can, or middle and high schools can reopen for the 7th through the 12th grade. In-person instruction has not been allowed for those grades because the science indicates that as students get older, they are more susceptible to becoming infected with the coronavirus that causes COVID-19. That is why the transparency of the COVID-19 safety plans is so important and why they must be posted on a school's website before the school can reopen. We will be talking more about that this evening. We know it's been a long, difficult 12 months, and we, like you, look forward to seeing our children back in the classroom. But we also want to ensure that we are bringing them back to healthy and safe environments for children, teachers, staff, and the community as a whole. The last thing we want to do is to do anything that would trigger another surge and have us fall back into the purple tier. So please stay safe, everyone. Continue to practice your precautions of masking and personal hygiene and limiting exposure with other community members and gatherings. And now I'd like to turn it over to Dr. Shende, our vaccine chief.
Thank you very much, Supervisor Gorin. We know so much more about how this coronavirus, about coronavirus than we did a year ago. How people get infected, how it's spread, what it means to have COVID-19. All the data puts us in a very different place than we were a year ago, when caution was the safest option and schools were closed to in-person instruction throughout our county, state, and our nation. I know it's been a frustrating and painful year for our children and parents and their teachers and schools. Remote learning is better than no school at all, but clearly it has its limitations. We're in a very different place now. Case rates have dropped significantly in our county. Each day, more of us receive vaccinations, with educators receiving priority. I know I sound like a broken record, but we simply need more doses. And with that, we'll be able to make even more progress. We're continuing to learn, but the science and the data tell us now that if we are careful and we implement and follow rigorous school safety plans, we can make in-person instruction safer. Our children will need to be wise and keep doing their part, meaning wearing a face mask properly, not getting too close to their friends and teachers, washing their hands. We know it's a lot to ask amid the understandable excitement of returning to school, but it's critical to the success of reopening our schools. As we know, children under the age of 16 do not have the option of vaccinations at this point. It may come later on at the end of this year, but at this point, preventive measures are really our only option. Meanwhile, we continue to make progress on getting shots to people. As of today, we've administered more than 212,000 doses in Sonoma County, with about 1 out of every 3 residents aged 16 and older having received at least 1 dose. And about half of those people are now fully vaccinated. We're roughly at 17% of full vaccination. The county is expected to receive 8,180 doses this week, which is an increase of about 500 over last week's allocation. That's progress, but that still means all but about 800 of those doses will be used for second shots. We still have a big second shot requirement, and so majority of them are going to be going into second shots. The big unknown, of course, is how much vaccine we'll be receiving from the state over the next few weeks. President Biden has offered encouraging words on eligibility for vaccines by promising that all adults will be eligible come May 1st. We appreciate his optimism, but the reality is if more people are eligible, more people will be waiting for vaccinations if we don't have more doses to administer. So we're hopeful that this statement also means that we'll see a significant increase in our vaccine supply and in our allocations locally. While we're pleased to finally be in the red tier, we want to maintain our momentum and move toward the orange and yellow tiers of the state's blueprint for a safer economy. Our adjusted average case load is now 6.8 per 100,000. We need to be at 4 to get into the orange tier, so we have some work to do, but we're moving in the right direction. The state plans to increase that number to 6 per 100,000, but only after 4 million doses have been administered to the 400 zip codes in California hardest hit by COVID. So that will take a couple more weeks. Meanwhile, our overall positivity rate is 2.5%, and our health equity positivity rate is 3.9%. Those numbers are a huge improvement and would qualify us to move into the orange tier if they continue to decline. I also want to give an update on the transition to the state's third-party administrator for vaccine distribution. The transition to Blue Shield has been more gradual than originally projected, in large part because of the complexity and importance of this process. That additional time has allowed us to keep advocating for fair and equitable distribution of vaccines in Sonoma County. And the good news is that we're being heard. We're working closely with Blue Shield. We're optimistic that we'll be able to provide vaccines to those important local partners that are not affiliated with large providers, including the Sonoma County Office of Education, to be able to complete their vaccination program. Blue Shield wants to retain most of the vaccine clinics in the network that the county has put in place over the last several months. That's very encouraging. Our conversations with them have been very open and very collaborative. The county will continue to support all these clinics logistically as needed so they can focus on what they do best, administering vaccines. A reminder is that the state's My Turn appointment system will be used by all contractors administering vaccines once we switch over to the third-party administrator on March 29. But at some point in the near future, everyone will use this system to schedule a vaccine appointment. So for now, if you haven't been vaccinated, we encourage you to register on My Turn and get familiar with the site if you haven't done so. So by the time that you are eligible, you'll be ready to go. The state will also have a call-in center for those who do not have computer access or who need registration help. With that, I'll now turn it back to Supervisor Hopkins.
Thank you so much, Dr. Shende. And I would invite all of the panelists to turn their camera on now. And I'm just so glad to be joined by such a fantastic panel of folks who really, really fundamentally care about education and care about students. You know, I want to start by just acknowledging what I think may be the elephant in the room is that we often see these debates that seem to pit teachers against parents, against superintendents. And you know, unfortunately, sometimes the discourse becomes very toxic, especially, you know, in social media and online. But what I have seen is a bunch of people trying their absolute best to ensure safety and to try to support their students. And so I want to just say thank you to all of you personally for the work that you have done on that. And I think I'm going to start off with an easy question that we can all just participate in by raising hands. Maybe I'll be a little bit of a teacher here. Raise your hand if it's your first pandemic. You know, at the end of the day, we are all trying to create new systems in an unprecedented situation that we have never faced before. And unfortunately, there is a tension between large groups of kids gathering together and having a great time and doing all that fantastic developmentally appropriate socialization and safety. And I think that's the tension that we are all feeling because it actually does exist, right? And it's just the simple, you know, epidemiology, the way that the disease works, right? Lots of people in close contact can create the spread of COVID-19. So on that note, you know, I'd really like to start out by talking to you, Dr. Harrington, around what has SCO been doing? You know, what are you doing to support school reopening in Sonoma County, and where are we in the process?
Thank you, Lynda. SCO is a state agency that's locally placed in the county to serve the districts in our county. We have been expanded to serve private schools, charter schools, and parochial schools. So that includes the 40 school districts, the 58 charter schools, the 24 private schools and parochial schools, all of which serve about 70,000 students in Sonoma County. As the state agent, our job is to coordinate between the county and the districts. So we've been meeting weekly, even before the pandemic, with the county health officer. And we meet every week, Dr. Shende, Dr. Mace and I, and Adam Radke, your counsel, to disseminate information to the school sites. And we produce a weekly bulletin to every one of those vendors who are providing services to schools, just so they can be current with the practice and the policies. When we started out, every school district had to start a health plan. Most boards approved their health plan in August. Then that was shifted in January 14th, that every school had to submit a COVID safety plan per site. And so if you were a purple school district, they had to submit them to the county health officer. And so we facilitated all that coordination between county health and the school districts in submitting those plans. But the other thing we decided to do was use our own resources and institute a vaccination clinic that Dr. Shende told you about. And that vaccination clinic will be closing approximately around March 25th, because we will have done our duty. We will have extended our services to 17,200 school employees from TK, or actually preschool, or daycare, and nannies and any other childcare provider, all the way through the university system. And we are in our last call right now. Dr. Shende and I talked about that today. We are doing our last call for educators this week and next week to finish this up. But that puts us in a very good position for reopening schools. We have ensured safety of our teachers and our faculty and our school staff who've been providing daily service. So I'm very proud of the volunteers who ran that clinic. They were SCO school nurses and LVNs and district school nurses and LVNs, all of whom dedicated their service to make that happen. And so on behalf of the county office, on behalf of everyone, I want to thank all of the volunteers and community volunteers who made that happen. We processed at our high point 800 vaccinations a day, and that's a pretty good total, Dr. Shende would tell you. And so we did a good job for that. The other part of it is the county and the local county office and the county health department have been collaborative in everything we've done so far. And we've worked very diligently, but the state changes rules on us often, and we have to then rewrite plans and amend situations. And so we have had to facilitate that. But we hold webinars as necessary, and we disseminate the information. To coordinate all these things, I meet regularly with the 4 field reps for the associations. There's CTA, AFT, SEIU, and CSEA. All of that has to be coordinated as we roll out these safety plans, all of whom are looking out for the safety of their employees. So those are the types of things we have been doing in facilitating the information, disseminating shots, and getting the shot clinic operational. So those are some of the things I'm proud of the county office for its doing. And I hear my dog barking in the background, if you want to know what that sound is. And so I will sum up there and put me on mute so you don't have to listen to a beagle howl.
Thank you so much, Dr. Harrington. Well, it's better than listening to my goats yelling for their dinner, which often happens during these meetings as well. So, turning over to Dr. Perez and Board Member Chimino, I just want to say, as a mom, right, I understand the desire to get kids back in school and how critical school and that socialization is for students' mental health. Can I ask, why this has been a top priority for you and what you've been doing in Roanoke Park to facilitate this?
Well, it's really important. We all thrive when we're able to engage in our regular daily routines. And when the pandemic hit, that was a real shift, a real shock to be trying to work from home. That's not how educators work. We're in there with students, we're working closely with them, we're engaging with them. So all of a sudden to be removed that way is a difficult situation. So since day one of my arrival in Roanoke Park has been really prepare for that safety, consider all of the guidance that we were provided, and then shift when the guidance shifted to make sure and ensure the safety of every staff member and every student. One of the things that I've learned from personal communications and personal stories is that people have been impacted by the pandemic in very personal ways. So some people are very frightened, and people say, why are you frightened? It's probably because of a personal experience. So we have to be aware of that. So what we've done in terms of the safety is we've set up our classrooms. We've made sure our ventilation systems are moving that air through so that we can ensure and provide that security to staff and our families that our children will be safe when they return, and also preparing for a different type of instruction. So those I have a long list of what we've been doing, but I'm really proud of the work of the staff and what we've been able to accomplish in terms of making sure that our facilities are safe and our classrooms are safe for everyone.
Thank you so much. And I'm wondering if either you or Board Member Chimino would like to touch a little bit on the hybrid model, and what you're implementing there in Roanoke Park.
Mr. Chimino, would you like me to take that?
Yeah, I was gonna touch in real quick on the why it's important to get kids back in school. And I know that it's only gonna be it'll feel like just a few weeks towards the end of the school year. But I think it's real important that the teachers and everyone gets to see all the children, check in with them, make sure they're, how are they doing mentally? How are they doing physically? Check in, like a third set of eyes on them, and to see what kind of needs can we try to, provide for them during the summer. Like where do the kids need some support, and get the students going, and hopefully train the teachers and staff to help out the students during the summer to get them kind of back on course. And then when we start school next year, when the pandemic started, we had to go to this distance learning, and it was pretty rough. So everyone buckled down, figured out what worked, what didn't work. And then when we came back to school, it was much smoother. So I think it's going to be the same thing. We're checking in, seeing what works, what doesn't work, how we're getting kids on and off, make it less stressful for parents dropping kids on and off. That's why those pods were super important, to get those kids, getting in. It's like a dry run, and we're checking in on the kids that need the most checking in on. And then next year when we're going, we're hitting it running and not figuring out as much. We already have a game plan, and we're training everyone, so we're all on the same page. All the sites have time to talk about it and be on the same page.
Just to follow up on that a little bit, Lynda, to Joe's, we're providing 8 behavioral health specialists that we brought on this year to provide districts. And of course, Myra's district is quite large, but to provide the smaller districts as well, behavioral health specialists, because as you've heard me talk about before, remember our 4th graders, kindergarten through 4th grade, have never had or have not had a full academic year. They have been victimized by fire, 3 fires, a federal disaster flood, smoke, and power outages. So our school children up into the 4th grade have never had their full 180 days of instruction. And so we realize that this is an adverse childhood impact experience, and we need to provide support. And the teachers need that same support. So we have brought on a crew of behavioral health specialists through a grant that we wrote. So they'll provide resources to Joe and the Catarirona Park School District, but they'll also provide resources to even our private schools should they need it, or should something unfortunately come up related to student issues. So I just want to let you, that's another thing the community has to be aware of. The sensitivity of coming back is not academic solely, it's also social emotional development.
Thank you so much, Dr. Harrington, for that additional information, and Joe as well. Dr. Perez, if you wanted to briefly touch on the hybrid schedule before we jump on to the next question, but I do think it would be great to hear what you guys are doing down there.
Yes, in Catarirona Park, for the elementary, we've chosen to do an AM/PM model. So we've arranged, we are currently working on that, where every children are selecting, or parents are giving us their input on whether we're at the AM or a PM model. So we have a cohort group coming in the morning, and then we have a 2-hour break in the middle, so we can make sure that our classrooms are clean for the next group. And then in the afternoon, we have another cohort coming. So, and Wednesdays will be distance learning with opportunity for meetings. And then in our secondary schools, it's a little bit different because of we have 3 cohorts rather than the 2 cohorts. So we have a 3x3 model that's been very successful at the high school, where it is the children are taking 3 courses. The students are taking 3 courses instead of 6. So we found that has decreased the stress and the anxiety. So students are doing better. And then in our other schools, because we have very unique programs, we're doing a rotating system. So, Monday, Tuesday will be one cohort, Thursday, Friday will be another cohort. So just a lot of variety and a lot of pivoting and shifting based on the guidance.
Thank you so much. Supervisor Gorin, I know that you started your political career on a school board. You're also a mom and a grandmother. And I'm just wondering if you wanted to touch on some of the challenges faced by families as well as school boards, with this pandemic and then their return to schools.
Thank you, Chair Hopkins. This is such a difficult time for parents and families, and of course, all of the amazing staff working in our schools. We want to assure safety, but the parents are really frazzled trying to share the bandwidth, trying to have often 2 or 3 person income earners, as well as guiding our our children through their instructional day, sometimes with success, sometimes maybe not. And even the best of us get exhausted through the Zoom lessons. I can't even imagine what it is for a child, especially with learning difficulties, to be in a class, in a living room with several other siblings, all trying to learn and focus. This is not what we talked about when I served on a school board. And we were talking about budgeting and class sizes and how to enrich the experiences. And I understand fully well of the anxiety and the frustration that all parents feel now. Today marks the day, 1 year anniversary of our shutdown. It's a horrible, horrible anniversary to acknowledge, and yet that's what we're doing. And I appreciate the explanations that you've given, because we are close to the end of the year, why we should put our children back in school, even for a couple of hours a day. And I absolutely understand getting them back into the rigor, the structure, the getting themselves up, getting dressed, not wearing pajamas, and moving forward in the school day. And I think even though it's challenging for parents to get them to the school for a couple of hours a day, they will share in the relief and joy of their children to be back in the classroom, maybe hugging, maybe not, but at least socializing with their peers. I thank you and salute you all for the amazing job that you have been doing this year, trying to help our children navigate through the most difficult experiences in their young lives. Thank you so much. And my hat is off to you.
Well, I think that's a great transition. Will, I would love to talk to you about the teacher's perspective. What are some of the concerns with returning to the classroom? And, echoing what Supervisor Gorin said, I mean, my hat is off to teachers. You have, gone above and beyond this past year. I mean, I think like all of us have learned how to do things that you never knew were possible virtually and via Zoom, and, trying to just bring that sense of spirit and joy through a screen, which is really hard to do. And is, surprisingly draining, I think, on the folks who are having to do that. I think it's been an exhausting year for teachers. And then also trying to figure out, okay, when is the reopening happening? Will I feel safe? Will I feel comfortable? I want to see the kids, but there's danger. I mean, that's a lot for teachers to bear. And I would just love to hear your commentary on behalf of the Teachers Association.
Well, thanks for inviting me. Santa Rosa has about 1/3 of the teachers in the county. So I don't speak for everybody, but I almost do, because these are universal issues. Firstly, I think what you can't stop teachers from doing is loving their students. You couldn't write it out in an MOU or discipline, too much love, like you just can't do that. And most of our anxiety and our challenges have come from how much we love our students and how much we want them to be safe and how much we want them to learn, right? So as we're transitioning, this is we're reinventing school for the 3rd time in a year. And it's extremely difficult. My wife teaches 6th grade, and she Zooms for 4 hours a day with students, and it takes her 12 hours of work to get that 4 hours of Zooming in. And there's also the asynchronous part, all kinds of new stuff. And here we are, we're getting pretty good at it, and we're going to transitioning it again to hybrid. So the anxieties that are coming from us are coming around that. Our number one priority is safety for students. It has to be, right? So we're working we have an MOU, it just passed today. If anybody was waiting on that, now you can say we have a ratified agreement. That's a really big deal for us. And there's safety upgrades all over the place that have things in it that we didn't know about in the summer when our original COVID MOU. Specifically, we got better ventilation. In the summer, we didn't realize how important ventilation is. Now that we do. So it feels really good for me as a leader that the school board and Dr. Kitamura and the other administrators, that we have been in lockstep solidarity about how important safety is. And as you mentioned earlier, Supervisor Hopkins, that's been one of the challenge, because we want physical, actual, don't get sick safety. And we also know that our kids are going crazy without being around humans. My own son, 5th grader, he went 3.5 months from Halloween till mid-February without a play date with other children. And he's healthy and happy, and he's a really good kid, and he's an easy kid to be a father to. And that was extremely hard for everybody. So multiply that time the 70,000 students that we have, and there is a lot of pressure to go in. So our balances are around that safety. The other part is, and this is really important for us, and I think it's probably important for every parent in the county to understand, and every administrator and every teacher to understand, we are going to dial hard to the left on the connection over content. This is disruptive. Students that go in hybrid are going to get less teacher time than they did in distance learning. They're going to get 2 touches a week instead of 4. Our model is A group on Monday and Tuesday, B group on Thursday and Friday. And so instead of being with their teacher 4 times a week, it's going to be 2, but it's going to be with a bunch of other kids and a bunch of other human beings, and they need that. So that's the direction that we're going. We're going to try to do it as safely as we possibly can. We know that we're going to sacrifice a little bit, and in some cases, maybe quite a lot on the teaching and learning side of it. And we also know it's going to be messy. I think we're going to get t-shirts made, Dr. Kitamura and I, that say, don't expect perfection, expect connection. And we're going to lead with love, and we're just going to do, it's going to be messy, but we're going to do every single thing that we can to make the most out of the 2 months that we have with them. And if I didn't say that, and if I was the crooked nose union guy that was telling everybody, don't work, don't do it, they'd run me out on a rail, because you just not going to be able to stop teachers from loving their kids these last 2 months. It's going to be different. It's going to be different, but we're going to do every single thing we can to get it right for our kids.
Thank you so much for your words, Will. And it just, your passion and love for your students really comes out. And I love that we're all coming from that place, right? We all want the same thing, which is safe kids in school. And yet there are these just clinical realities that we have to face, which I think is a great transition to Dr. Green. I'm wondering if you could share a little bit of a clinical perspective, with respect to, why are there apprehensions around students returning to school, and what's the clinical reality that we're facing?
Yeah, hi, Supervisor Hopkins. Thank you very much. I hope you can hear me well. So there's a couple things we want to do now that we couldn't have done a year ago, and that's now we have some science. And so I think those of us in the clinical realm of this pandemic want to look at the science and say, what do we know, and how can we move forward with safety? Now, I'll preface that to say that we're a country that's done a horrible job at this. We're a country in the developed world that's been sort of an embarrassment, because we haven't made the right steps. And those of us, myself included, who takes care of patients every day in the ICU and has seen families struggle, seen families not say goodbye, and seen a number of patients die, it's been a heavy burden. Now that also, I'll couple that with that I'm a father of a high school kid in our public system, and also a college kid that kind of came through our public health school system. So if we look to the science, I think whoever made the decision to open up an elementary school has done the right thing. We know that the science is children under 10 have fewer receptors in the respiratory epithelium to acquire the virus and transmit the virus. That's a good thing. So opening up elementary schools in a very careful way is super sensible and much safer than, for example, trying to open up a college campus. So I think that that's really important that we follow the infection prevention guidelines that have worked for other things like influenza and noroviruses that can sometimes affect a school system. So by being very careful in mandating masking, social distancing, hand hygiene, cleaning workstations, I think that's going to be really important. And you can do that in a much more controlled setting, like in an elementary school, than, for example, you could in a high school. So I'm very comfortable having my daughter at home this year because she can't be vaccinated yet, even though it's her senior year of high school. And clearly it has been an emotional, a psychological, and a mental health impact, let alone a challenge to her educationally. And now she's heading into college, and that's going to be a struggle as well. So I think that we really need to work closely with public health officials, because now we know that we have a virus circulating out of the UK that's much more transmissible, and it's also much more dangerous. it has a higher lethality rate. So not as many people will survive that virus. We also know that the vaccines in the US have been very good, and they're going to stand up so far against the variants that are circulating. So we're not through the pandemic yet, and we're very likely going to hit a third wave. I think Anthony Fauci from the NIH said it very clearly. We're in a perfect storm. Certain states are opening up much more than California. The UK variant, the South African variant, and the Brazilian variant will become worldwide pretty soon, if they're not already in the US. I think we're seeing a time right before Easter and other holidays and spring break, when families are going to open their bubbles too wide, and we're going to see more transmission. So I think we are going to head into a third wave. And if history tells us anything, in 1918, they did have a third wave. It wasn't as bad as the second wave, but it mirrored the first wave. And we have not reached herd immunity yet. We're not even halfway there, not even a third of the way for herd immunity. However, we have really protected those that are very vulnerable, including the elderly. I'd like to speak a little bit to people of color. I mean, my own background is half Mexican, but I love the Latinx community. And I will say that oftentimes certain communities ethnically are multi-generational in a house, or they're multi-generational in their interactions. And we know from history that what happened with Italy in the first wave is that Italy had multi-generational houses, and that's why their first wave was so dangerous and so lethal. We also know that in New York, their first wave started, and partly because they did not lock down the school systems, the public school systems, and that really contributed to their first wave. So my basic point is, I think it's okay for us to start thinking about considering and carefully open up school systems, but I think it's going to have repercussions. And if you don't do it very carefully, in a country that doesn't have a good track record, we're going to see many more people die. Not in the school system, I think, for those under 10, but definitely at the college level, at the high school level, and above that. We're already seeing some early deaths in the country. You want to be careful about that. So working closely with science is going to be absolutely imperative. And we need to listen to the right people to make science decisions, such as Dr. Mays, Dr. Anthony Fauci, and those of us on the front line.
Thank you so much for those words, Dr. Green. And I think it's so important to have that grounding in data and in reality, right? Which is that as much as we all would love to return to a normal society, we simply aren't there yet. And if we go too far too fast, we're going to find ourselves slipping back out of that red tier and into the purple tier, and in similar circumstances to when we found ourselves before. And I think that that's almost more devastating emotionally, right? That up and down for students, for teachers, for everyone. So it's really, really important to do this right. Thank you all. So fantastic, conversation. And I just really appreciate you all being here and the passion that you bring to this for the children, really, at the end of the day. I'm going to hand the reins over to our fantastic Public Information Officer, Jennifer LaRoque, and she is going to take it away to invite questions from the public and also from the media.
Thank you, Chair Hopkins. I appreciate the introduction. And so now we're going to look to our Facebook channels for questions from the community. So please feel free to write in your questions there. And I'm going to start us off with the question we've received definitely most during this conversation. And that's regarding the 6-foot social distancing rule and how that applies in schools. And so Adam from County Council, I was hoping you could shed some light on the county's role in the 6-foot rule and what that looks like in schools right now. And, Dr. Harrington, please feel free to jump in as you like.
Yes. So the state guidance for the state revised school reopening guidance currently says that the standard is 6 feet. The floor is 4 feet. However, if a school wants to establish student desks less than 6 feet, they need to be able to show good cause for why they couldn't design their classroom in a way to achieve this 6 feet distancing between student desks. Good cause includes being able to show that they've considered all indoor, outdoor, and hybrid models, and that as a result of those considerations, they could not achieve that 6 feet distancing between student desks. That's what the revised state guidance currently says.
basically we've told our districts that, 4 foot should be the anomaly in a classroom, not the convenience of the classroom. And so that's why we are following that guidance. I got off of a phone call on Monday with the state health director, and they were talking about, they were looking at the data for the fall reopening. They would look at the World Health Organization model possibly for the fall, but they will do a new revised CDPH for the fall reopening. But this is our guidance now. We're grateful to be out of red to purple. We are so glad to be in a new color combination and with greater liberty and get our kids back together. So we're learning to live with the 4 to 6 feet definition. Teacher must always be 6 feet. That's a Cal OSHA requirement. And that's because they are just more susceptible, even though we've already got them all immunized, but it's just something we have to keep in mind.
I appreciate that information. Thank you. And Superintendent Harrington, I'm wondering if you can actually kind of continue that line of thought. We've gotten some questions about, how long we expect this hybrid model to last. What are we expecting in the fall? And Dr. Shende may be able to weigh in here, and Dr. Green, from the health perspective. I know we call it looking into that crystal ball. We like to do it every Wednesday. But what are we looking at down the line?
Well, what we're looking at right now is we're just getting the athletic guidance, which has already been revised once and will be revised again in a few days and get disseminated, and that's going to need to roll out. And then we're going to have to look at graduation guidance for graduation ceremonies, and that has to roll out, so we'll be doing that. And all of that works between county health and county office of education for the districts. So those are the things we have on our plate coming forward. We believe from the education community that there will be revised guidance for the fall reopening. We just don't know what that is. A lot of that will be probably, Dr. Shende will probably be able to talk, a lot of it will be predetermined on vaccinations. I know they're currently even talking about children being vaccinated, and we don't know what that protocol will be and what age, but those things are all prospective and they all influence the decisions we make. So the decisions we make today could be changed 3 weeks from now based on new science and new information. And one of the things, and I think that our teachers will all agree, to be a teacher, you have to be flexible. No, there's never the same day in your classroom. So we have been flexible, multi-flexible to address all these issues. If someone tells me I have to write another plan, I don't know what I'll do, but we have had to write more adaptive plans to make this happen. And we probably will have to revise our plans for the fall reopening. But that's it. We're flexible. We'll do what has to be done, as Will said. We care about our kids and we want them to be safe.
Yeah, if I could jump in there just to add to what Dr. Harrington had to say. As he said, it's multifactorial. There's not one single thing. It really depends on, number one, if we get vaccines that we can use to actually immunize people. Number two, the rate at which we get them. The variants, as Dr. Green mentioned, we will have more information and more data over the next few weeks to months to see whether that plays a part in our disease incidence. And then, of course, the case rates. Thankfully, they continue to drop, but we really need to see them drop to insignificant levels before we can make any predictions. Hopefully, if we have a steady vaccine supply that's increasing, we can hopefully get to close to herd immunity later this summer, early fall, something like that. We can't make any guarantees, of course, but that's going to be a big game changer for us. The other issue is vaccines for children. So there are studies underway. Moderna is studying 12 years and up, and there's talk about starting to study children even younger than that. So again, multifactorial. I'm sure that Dr. Green has a few things to add to that as well.
Well, I think that there are some other strategies that we can use to make successful planning in the future. Vaccine is going to be very important, but also we're improving our testing capacity. And it might be like when people travel and need to be tested first. We may have a graduation ceremony where people need to be tested first before attending. And then if you do that graduation outside, not indoors, you've limited the danger of having the virus spread. So I think there are some strategies from an infection prevention standpoint that can create a safer environment for kids to get together during certain things like graduation. I think we're not going to know the end of the pandemic until we reach herd immunity, and we know that the vaccines will work for other virus strains. So far, except for AstraZeneca vaccine, the other vaccines are holding up really well. And I think the faster we vaccinate, the more quickly we lock down virus transmission. So I think there's a lot of good things we're learning, and there's a lot of hope in the future. And I think we're going to see things a little bit better. And I think this is going to be the hard year, and next year is going to be much, much easier.
Thank you for that, Dr. Green. I appreciate it. And similarly, we're receiving some questions about high school. When can, Melissa is asking from Facebook, what about high school? Can this group speak to, where high school stands right now regarding opening? So what steps do high schools need to take to open? And then, I'd be curious, I think we mentioned a little bit earlier, but just a little bit more information on the clinical concerns with high school students. Dr. Green, you mentioned elementary school students feeling very comfortable, high school students starting to get a little bit more risky. So anything else on that? But Adam, perhaps you could start us out with where we stand with opening high school districts. And, Dr. Harrington, please feel free to chime in.
Yes, so the state order says that once a county enters the red tier, which we're currently in the red tier, then all schools may reopen for any grade TK through 12, as long as they post online their COVID safety plan at least 5 days before they begin in-person instruction.
Thank you. So
Just
then,
to add on to that a little bit, you'll find that most districts have done that, and most districts have posted their plans. So I would encourage parents to go to their school site website and check that out. The other thing I would also add is that high schools will be reopening, but the biggest issue with high school setting is socialization, that students don't necessarily follow the rules very carefully. And I will leave that to Myra to talk about, and Will, and maybe the board member, Joe, from Katati Rona Park, to talk about how they're going to control that in a high school setting. So Myra, you have a high school. How are you going to control that?
Well, we really are. There won't be a lot of long breaks, because we know adolescents crave the socialization and want to congregate. And we know that the science tells us that that's not a good idea for our older students. So we've created a pretty tight schedule. People will have breaks, but it's very, very limited time. And as I explained earlier, they will have less courses. So there's less movement and there's less time on campus, simply to prevent that, that socialization, which we all crave. But at this point, we have to be safe about and follow the science. So that's a little bit about what we're doing, is controlling those breaks. And people, all hands on deck. We will have to be present, administration, staff will have to be present to remind our students that they need to remain safe.
thank you. Board Member Joe, anything you'd like to chime in? Joe, it is possible that you have turned off your video instead of unmuting yourself.
Instead
just
of
in
your
case
mute,
you
yeah.
wanted to. There you go.
I hit the space bar. It must have already. So anyways, that's one of the reasons why I'm not in education. That's, I think, it must be a very stressful thing. And I think a lot of training, and also I believe with our models, if it's not working out, you can go to distance learning and still stay in your cohort. So some people don't feel comfortable going back to school, so they can, if it's not working out, they can go back to distance learning and still stay with their class, and then maybe try it again later if they can, figure it out.
Appreciate that perspective. Thank you. Dr. Green, anything you'd like to add?
Well, I think that the high school and the college groups are a little bit worrisome, because most of them are not vaccinated. And so they're a very vulnerable group, not only to just get the virus, but also to transmit it. There was a good study done with the USS Theodore Roosevelt. It was an aircraft carrier that got infected, and this was with a less contagious strain of the virus. And we know that in 4,400 of those aircraft carrier, very young, 20-year-olds, mainly healthy cohort of people, where they tried to quarantine that aircraft carrier and be very careful, they had a few hundred people who became infected, and they were asymptomatic. And 36% of the ship were asymptomatically infected. And then only 6 people were ill enough to be hospitalized. but they did have one fatality on that ship in a 20-year-old person. And so I think the lesson there is an aircraft carrier of 4,400 people will have a number of asymptomatic infections. We should expect that in high schools and in colleges. And there will be a very few number of people who might get ill enough to be hospitalized, but there's going to be a fatality. And so we have to balance that on the compliance and the seriousness and the ability of high school and college kids to kind of follow in a more mature manner. So there is a risk there. And I think that the elementary schools pose a lower risk than the high schools in the college setting.
Thank you, Dr. Green. I think maybe we need a video of you saying that to our high school students, every morning. So start their days. So now we'll go to a few questions from our media. And Phil, I see you've got your hand raised. Please feel free.
Was that to me? I was going to mention, I'll make it brief, but we also have secondary students also includes middle school students. And one of the big challenges is we're in the middle of staffing getting ready for elementary because somewhere around a third of our students are going to stay distance learning. They need teachers too, but we also have to staff the ones that are in the room. That's a challenge. And that's elementary students have one teacher, right? You go to middle school and high school and they have 6 teachers. So it makes it 6 times harder to isolate them and to, control movement. They're going to go to 3 different stable groups a day for 80 minutes on the 2 days that they're there. So what I would like to ask the community to help us do is, including the students, including the parents, the teachers are going to be right on top of it. We need help to obey the guidelines and keep our 6 feet and keep the masks on and wash your hands and do the symptom check in the morning. Don't skip that step. And if you don't feel good, don't come in. Teachers, pre-COVID, there's a saying, it's better to crawl in than to call in. Because if you're sick and you got to write a sub plan and then deal with the mess, a lot of teachers that just take some medicine and come in. We cannot do that. We've got to really recognize that every day, even if there's only 10 of them between now and graduation, every one of those days is a gift. And we need to honor that by behaving and doing it right. So I just encourage the parents and the students and the teachers, safety first, including emotional safety. We have students who haven't been on campus for a year. We have some students, the kindergartners, they've never been on campus, right? This is going to be a brand new thing for them with masks. There are going to be a lot of big feelings on April 1st. And there are going to be a lot of big feelings. Our secondary is coming in April 26th. So we're going to have to be ready for that. In our district, we're talking about teaching them how to express love and excitement from 6 feet away. So we're going to do air hugs, finger guns, boo, 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 boo. I don't know what else. Tip of the hat, maybe. We're going to add all these different things, but we have to express love to each other. And we have to stay 6 feet apart. So it's just really important. It's going to look different, right? If anybody's thinking, hey man, on April 1, we go back to pre-COVID teaching and learning, that's not true. August is a dream. We hope we're back to pre-COVID teaching and learning, but we got to follow the science. Good chance it'll be hybrid, or we'll still have masks, or who knows what. Anybody tells you what's happening in August, they're pulling your leg. We just don't know yet. But we know that coming in right now, we're taking big risks. We're not that far away from purple, right? Like 3 or 4 days or something. This is changing fast. We just have to respect that. So I hope all parents and teachers will honor that are bringing their kids in.
If I may add one quick thing, I think a common misunderstanding in terms of the symptoms is that if you don't have a fever, then you don't have COVID. You have to have a fever to have COVID, and that is not true at all. We have found many times that children may have no symptoms whatsoever. They may have just a little bit of a runny nose, a little bit of a cough, and oftentimes no fever. So any change in symptoms whatsoever is reason to stay home, be cautious, get tested, because it's extremely difficult to diagnose COVID based on symptoms alone.
Excellent point. Thank you, Dr. Shende. I appreciate that. Okay, so turning to our media partners, Phil Barber, you are up and you'll just have to unmute yourself.
for briefly steering this away from education, which I know is really important. Dr. Shende, I wanted to clarify one thing. I believe you said 8,180 doses of vaccine expected this week. Does that mean we haven't received those this week, or is that expected for next week?
Hi, Phil. I have my numbers ready. I knew that you were going to ask. So we usually get our email. We get an email that tells what our allocation doses will be that we will receive on Monday. And so for the week of the 23rd, we will have 8,180 doses. And that breaks down to 4,680 of Pfizer and 3,500 of Moderna. So no doses of J&J or Janssen vaccine for us for this week. Hopefully we'll get some the following week. But yes, these are the doses that will actually come into Sonoma County as of Monday morning.
Great, thank you. And then I had a question about Johnson & Johnson, and I would love to hear answers from Dr. Shende and perhaps from Dr. Green as well. I'm hearing a lot of messaging from the county, from hospitals, from clinics about the efficacy and the safety of Johnson & Johnson. And I'm guessing that I wouldn't be hearing so much of that if there wasn't some concern about resistance to the J&J. Is that all hypothetical, or are you hearing anything specific about resistance out there? I've had a couple calls from readers who were trying to find Moderna or Pfizer because someone in their family was concerned about Johnson & Johnson.
Dr. Green, I'll let you answer that.
Yeah, I can take that. So when the Moderna vaccine and the Pfizer vaccine were being developed and being studied, we had one major variant in the world, and that was one that came out of Italy, and it was less contagious and not as virulent. When the J&J vaccine was being studied a few months later, just a few months, we actually had 3 different international variants circulating. But the J&J vaccine, which is only a 1-dose vaccine, was able to hold up almost as well as the mRNA vaccines with more difficult variants. So you can't really compare those numbers of the mRNA vaccine to the J&J vaccines. It's a little bit apples and oranges because that 2-month lag period was a very different pandemic with much more contagious viruses. So I really think the J&J vaccine is so good, it only needs 1 dose. And I really find it equivalent to the mRNA vaccines. And I would get either vaccine for my patients or for my family.
And I'm sorry, but is there any reason for you to believe that people haven't been receiving that message?
Well, at Sutter, in our Sutter healthcare system, we very carefully anticipated that the public would not be able to understand the numbers and understand the studies. So we tried to make that into some very basic talking points. And I'm sure that Dr. Mays and the health system, the public health system, have taken the same approach.
Great, thank you.
Thank you, Phil. Appreciate your questions. And Martin, you are up. You'll just have to unmute yourself.
Hi there. Can you guys hear me okay?
Yes, thank you.
My question is for Dr. Green. Dr. Green, you spoke about a third wave. I wanted to ask you a stupid question about the variants, and I don't have your expertise, but we're seeing the variants. They're out there. They're circulating. Why are we continuing to see cases decline? Is it that there's just less transmission of these variants? He's muted.
Oh, yep.
So I've actually seen a shift in the pandemic. I've actually seen people of younger age, in the 40 and 50-year-old age range, come into the ICU, get intubated, and some of them not survive. So we're actually seeing a more severe viral infection in younger people as well. But we're seeing fewer cases. And the reason is, despite the variants being more contagious and more severe, we're able to flatten the curve with our public health standings. So this means that people are doing the right thing. I see people at Costco wearing masks and keeping social distancing. I see people wiping their cars and their carts so that they don't transmit the virus from one cart to another, for example. I think public health measures in Sonoma County are working despite the variants being here already. But for the few that do get infected, it's a much more difficult course to survive and to get through.
So as a follow-up, so if we have another wave, a third wave, what makes you think that it will be more along the lines of our first wave and not our second wave?
In the 1918 pandemic, we actually saw that in the third wave. And I think this pandemic has followed the 1918 pandemic, even though that was influenza and this is a coronavirus one. But I think we have enough vaccination to have more protective immunity in more elderly populations and people more at risk. So I think we're kind of focusing our efforts very appropriately to people who would otherwise not survive a viral infection. That I think is going to help in the third wave, so it won't be the same hammer that we saw in the second wave. I also think that people are being much more careful. We're seeing people not get together for big family parties and picnics, but it's really hard not to open your bubble a little bit. And 99% of the time, when I see someone in the ICU with COVID and we have a conversation, I ask who at home is sick? And the question is everyone, and the answer is everyone. And the reason is once it gets into the household, that is such a high risk setting, it's hard to keep the virus from spreading. So we need to keep it out of patients' households by following public health measures. If we do that as more variants circulate, if we do that as spring break is upon us and Easter's around the corner, if we're careful about that, we'll flatten the curve in Sonoma County to a significant degree.
Thank you, Doctor.
Thank you, Dr. Green and Martin. I appreciate that. Carrie, okay, our last question. You are up and you'll just have to unmute yourself.
Great. Can you guys hear me okay?
Yes, thank you.
Great. My question, I think, is for Dr. Harrington and Dr. Shende. It's no longer required, but are you both recommending that districts and schools continue to submit their COVID safety plans or go through that process till the end, even if it means a delay? I mean, I think there's some people out there that would say, hey, we're in red. Let's just post the plan and go.
So my recommendation that they submit it because remember, we have no liability protection and we need this type of county health approval. At least you have an approved plan that's been reviewed and that gives you some sense of, and parents some sense of security that the system has been checked. So our advice from the county office to every district is submit your plan, have it reviewed, and they will give you feedback on it. And I don't think that's changed, Dr. Shende, when we talked.
Yeah, I completely agree. And if we do see that there is increasing infection rates, for example, as we start to open up, then at least we have some baseline. We know what the safety plan was. We can see what things might need to be changed. I think it's a good idea to have that baseline in place as we move forward.
Okay, thanks very much.
Excellent. Thank you all. Well, then I believe we will wrap up there for today. I just want to thank all of our community members who joined, our media folks who participated as well, and of course our panelists. Thank you all for taking time out of your day. You all do a lot for your communities already, and here you are showing up at 6 o'clock on a Wednesday. So thank you for your work, and we'll be back here next Wednesday for our normal briefing. So feel free to join us, Facebook and YouTube for Spanish, and take care, everyone. Stay safe.
Thank you.